Hello, my name is Sandra Moll. I am an occupational therapist and associate professor at the School of Rehab Science at McMaster University, and also the developer of the Beyond Silence app. And this has been part of my program of research for the past 15 years, I would say, really looking at how do we promote earlier intervention and support for healthcare workers.
Hello everyone, I'm Sheila Addanki. I'm a PhD candidate working with Dr. Sandra Moll on the Beyond Silence program. And a lot of Beyond Silence work has been a part of my PhD thesis as well. And like Sandra mentioned, that it's been a wonderful journey in trying to be able to develop supports for healthcare workers.
The idea for Beyond Silence came from the fact that many healthcare workers, often there's a long lag time between the onset of symptoms and seeking support. And so really for healthcare workers is how do we promote earlier intervention and support? And right now, the healthcare system is in crisis. There are many, many healthcare workers struggling, and we're trying to think about tools to be able to help them to get the supports that they need in a timely way. This project has been, about 6 or 7 years. We started with a small Catalyst grant. We had a hackathon supported by CIHR to start to design and to build, to conceptualize this app. And then we had a working version in 2020 when the pandemic hit. And we have been really working since then about how do we make the app current and relevant to healthcare workers in this current crisis in the system.
The app is built on the co-design principles of providing care to healthcare workers, and it incorporated trauma-informed principles. It also incorporated information from evidence-based resources to develop articles that are relevant to the struggles of healthcare workers. I think one of the biggest successes of this year is the piece around peer support. I think we were able to build a great community of peer support providers. We've trained several healthcare workers across Canada on being able to provide peer support via the app. I think the next thing is to be able to scale up implementation across more organizations and be able to expand and reach remote, rural healthcare organizations, different types of diverse healthcare organizations like large hospitals, long-term care homes, community care homes, and places like that. So I think that's our plan for this year.
Within the organization itself, you can build customized resources, local resources, and there's an organizational code for your employees to access. And the app is completely private. We do not collect any information from employees about who they are. And so their data is secure, and we do not know who they are in the app. So that helps with anonymity within the app.
And it makes people feel more safe to use this app.